All right, thank you for submitting your email address. I promise it will only be used to deliver information that has the potential to be life-changing. Now, if you'll bear with me for a few moments, I'd like to share the Reader's Digest version of how I got from being frustrated because I couldn't help my precious fibromyalgia patients to a place where I get consistently positive results. So allow me to share a little bit about myself so you understand the context of my experience with fibromyalgia patients. Now, keep in mind, I'm not a movie star. I'm putting this on video so I could share this message with thousands and hopefully hundreds of thousands of people that are suffering from these chronic conditions like fibromyalgia. I am a doctor of chiropractic that specializes in chronic conditions like fibromyalgia. My grandfather was chief of staff at Mount Sinai Hospital in Miami, Florida, and my sister is a pediatrician. The reason I went to chiropractic college was because I really wanted to be an asset to the community, wanted to help people enjoy a better quality of life, and provide for my family of 7. I went through 4 years of chiropractic college. I passed 4 national board examinations, which are 3 days each, and I passed 2 different state board examinations. When I got out into the real world and started practicing, I got great results with headaches and migraines, neck pain, low back pain, hip and leg pain, and that was extremely rewarding. Unfortunately, I started seeing more and more people who had been diagnosed with fibromyalgia. The unfortunate part was that they didn't respond very well to normal chiropractic care. Keep in mind that one of the main reasons chiropractic care is so effective is that it allows the brain to communicate clearly with the rest of the body. We do this by removing nerve interference. As many of you probably know, perhaps better than anyone else, is that there is a tremendous amount of muscular pain involved in fibromyalgia. So initially my hope was that as I removed this nerve interference, the pain would go away or at least get better. We did have modest success. Unfortunately, some of the very difficult cases that patients, well, actually the patients couldn't stand the pressure of the actual adjustment. They would really be in more pain for several days after the adjustment. This didn't make me happy, and it certainly didn't make them happy. I realized that at that point, I didn't have the knowledge required to help our ever-increasing fibromyalgia patient population. Statistics say that 5 million Americans suffer from fibromyalgia. My guess is that it's at least double that. That's where my quest began. I was determined to find the cause and the source of the symptoms of fibromyalgia. Through my personal study of the research revolved around fibromyalgia, I was sure that there was a neurological, a physiological, and a nutritional component to this disease, and something that tied them together. From that point, I spent well over 500 hours in structured classes getting advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, mastering the thyroid protocols, and getting an additional certification in functional medicine from Functional Medicine University. At this point, it's important that you understand what functional medicine is. So please, I'm trying to build a foundation that we can move forward upon. So we're talking functional medicine. It's a patient-centered medical healing at its best. Instead of looking at and treating health problems as isolated diseases, it treats individuals who may have bodily symptoms, imbalances, and dysfunctions. Think about what I just said. Bodily symptoms, imbalances, and dysfunctions. And as you'll soon find out, this probably describes you quite well. Now, use your imagination with me. Picture an iceberg. Consider the fact that 80% of the iceberg is underwater. So in your mind's eye, I want you to picture a huge iceberg where you can see the bulk of it underwater and just a small tip above the water. Well, fibromyalgia might be visible above the surface, but according to functional medicine, the cause lies in the altered physiology below the surface. Almost always the cause of the disease and its symptoms are an underlying dysfunction or an imbalance of these bodily symptoms. So you have to consider the inflammatory imbalances, hormonal imbalances, detoxification imbalances, mitochondrial dysfunction, toxic chemical exposure, digestive, absorptive, and toxic conditions. The list goes on and on. So the named disease is just the tip of the iceberg. Below the surface, according to functional medicine, which is what I practice, that's where the real cause of the patient problem exists. So if healthcare treats just the tip of the iceberg, it rarely, if ever, leads to long-term relief and vibrancy. Identifying and treating the underlying root cause or causes, as functional medicine does, has a much better chance to successfully resolve a patient's health challenge. Using scientific principles, advanced diagnostic testing and treatment, other than drugs and surgery, functional medicine restores balance in the body's primary physiological processes. The goal is the patient's lifelong optimal health. So today's healthcare system is truly in trouble because it applies a medical management model that works well for acute health problems to these chronic health problems where it's much less successful. So if you have a heart attack, an accident, or sudden lung infection like pneumonia, you certainly want a quick-thinking doctor to use all the quick-acting resources of modern medicine, such as life-saving technology, surgery, antibiotics, whatever it takes. We're all grateful about these interventions. However, jumping in with drugs, surgery, or other acute care treatment too often does not succeed in helping those with chronic, debilitating ailments like fibromyalgia, and I have a feeling you can attest to this. Another approach is without question needed. That's where functional medicine comes in. This is what I hope to share with you. In a few days, I will send you a link to the next video, which will go into more detail about what we consistently find in the fibromyalgia patient and how you can use these findings to recover your health, fulfill your potential, and reach your destiny. Thanks so much, and I look forward to speaking to you in a few days.